Hello everyone, my name is Marissa Komp and I am a second-year veterinary student getting my doctorate as well as my master's in public health at Kansas State University. I will be competing in the graduate division for this conference. My project is titled A Pilot Study of Pain Assessment and Activity Tracking in Dogs Undergoing Radiation Therapy. First, I'll begin with the background. Radiation therapy is an important modality for cancer treatments in dogs and as well as humans, and it is effective especially for localized tumors. It is shown to increase the lifespan and quality of life for dogs. However, monitoring health changes and treatment responses can be challenging. There are two approaches to radiation therapy, definitive and palliative. Definitive treatments are controlling cancer for a long term and generally consist of small doses daily for 3 to 4 weeks and best attack localized diseases to increase the lifespan. In contrast, palliative treatments relieve pain or distressful conditions or improve functional deficits with the main function to improve quality of life. In this study, we wanted to find a more efficient, quantitative, and accurate way to assess the response to these treatments in addition to periodic clinical assessments. The goals and aims of this pilot study were 1, to better assess radiation therapy response and monitor its side effects, 2, to understand the changes in radiation patients' activity levels, and 3, to investigate the overall quality of life throughout radiation therapy and follow-up. Our study used 2 methods for monitoring these changes: an owner questionnaire and an activity tracking device. An activity tracking device, in which we used FitBark 2, was attached to each dog's collar to provide minute-by-minute data. This beneficial sensor provided almost real-time data in the form of activity points, called bark points. The other methodology we used was an online questionnaire for pain assessment and quality of life and detected the owner's perspective on the patient's behavior and pain. There are multiple questions about their pet's alertness, level of happiness, sleep quality, and more, using a Likert scale scored 1 to 5, with 1 being much worse, 2 being worse, 3 normal or no change, 4 better, 5 much better. We also had the owners score their pet on its overall quality of life, or QOL. 0 represented very poor and 10 represented excellent. These surveys were sent out to treatment groups weekly and the control group twice, 2 weeks apart. Here is a list of our dogs enrolled in the treatment group in our study. As you can see, there are 4 definitive and 11 palliative patients being treated for various types of cancer, including osteosarcomas, nasal carcinomas, hemangiosarcomas, and more. Our control group consisted of 8 dogs varying in age and weights. We are actively tracking 10 dogs and actively enrolling dogs that are undergoing radiation therapy as well. Our preliminary results revealed a slight decrease in activity and a marginal increase in overall well-being of treated dogs compared to controlled dogs. You can tell the activity levels are very different, and this may not only be due to treatment, but also the fact that our control group included younger dogs. So moving forward, we are looking to enroll dogs who are more comparable in age to our control group. An observed trend was the dogs that received radiation treatment can recover quickly in terms of activity and get back to their normal level. They last for a while, but then go back down again for a few, and those are mainly the dogs that we have longer follow-ups with. This was expected for our palliative patients, as they have a transient therapeutic response and develop a very progressive disease. In the results, we can compare our daily activity levels between groups, and you can see the difference in the control group versus the treatment group's level of activity. The x-axis portrays 1 full day, with the left side being midnight to early morning, the middle being noon, and this being night to 11:59 p.m. The black line represents the average for each group's activity or bark points. Each colored line represents one of our patients. You can appreciate the variety of routines, agility levels, and more. For example, this could represent an owner waking up in the morning and letting their dog out, coming home at lunch and letting their dog out, coming home from work and letting their dog out. There are some limitations we have found with this part of our study. Overall, the FitBark device is a very useful, effective, and accurate tool. However, we have ran into some issues with owner compliance and syncing their data to the app, Bluetooth connection errors, and whether or not the sensor is easily wearable. Most dogs have collars and this works nicely, but for those who don't, it presents difficulty. One of our dogs discontinued as she was not used to wearing a collar. Here you can see an example of what our app displays. So this would be the activity points for that day and the goal activity points with the sleep score and the journal entry section. And then you have an hourly breakdown of the different kinds of activity, which they break down to sleep, play, and active. And then you have a weekly trend that they show, as well as an hourly breakdown for that. Looking further at our results, I have an example of a definitive patient and a palliative patient. Our definitive patient's daily activity profiles shows every day for a week with each box representing a week's worth of minute-by-minute data, and the black line still representing the average, but for a week's worth of data and activity. The longitudinal activity profile is the summary of each dog's minute-by-minute data, but because this data is such a large quantity, a mathematical function was used to formulate it, to determine the trend of the activity over the course of their treatment and follow-up. The red line indicates where the patient completed the radiation therapy treatment. Here you will see that initial decrease in activity that I had mentioned earlier that eventually goes back up to their normal. We also show the health score average and the quality of life score. In our palliative patient, we have the exact same activity comparison. So first, you will see our definitive patient eventually recovered, and this is shown in not only an increased recovery health score, but as well as an increased quality of life score. In our palliative patient, you can see the same display of activity points with each line being a day, each box representing a week, and so on. And the black line is still the average for that week's worth of activity. The longitudinal activity profile using the mathematical function I discussed, and the red line marking where the patient completed the radiation therapy treatment. This dog also exhibited initial decrease in activity and slightly went up after that. However, the survey scores indicate that this was not a recovery case because it was palliative, and unfortunately the cancer was very aggressive and progressed shortly after completion of palliative radiation therapy, and metastasized into other areas of the skin and lungs, which reflected in the health and the quality of life scores, as well as activity points. In conclusion, we observed a slight decrease in activity and a marginal increase in the overall well-being of treated dogs compared to control dogs, and believe the benefits of the biosensor and survey also extend to the owner by involving them in the treatment evaluation process, which has potential to improve patient care. We hope this study encourages future studies using biosensors on veterinary patients as well as human patients to track their response and recovery to improve the treatment process. But ultimately, owner compliance and engagement is the key for success. We expect that with a larger sample size, these data will indicate that activity tracking in a novel questionnaire will provide useful remote assessment and stimulate proactive communication regarding quality of life. And this has the potential to improve patient care for dogs undergoing radiation therapy for cancer, as well as other treatment protocols that can be replicated in the human medicine realm. Thank you to the judges and everyone who listened to my presentation, and please feel free to contact me with any questions.